This is BBC Radio 4 Now, You and Yours, with Winifred Robinson in Salford.
Good afternoon. Welcome to Radio 4's daily consumer programme. Today, the first interview with the Atos boss who runs the government's controversial Fit for Work assessments. The company Atos tests sick and disabled people to see if they're fit for work. The tests are meant to weed out false claimants and to encourage people who could do some work to take up the offer of help to find it. But the company's come in for an awful lot of criticism. One MP described it as feared and loathed in equal terms. Atos has refused all requests for interviews until today. Lisa Coleman, who's in charge of the sickness benefits contract, has agreed to speak to us. We'll hear from her in a minute. First, though, some context from our disability reporter, Carolyn Atkinson. Carolyn.
Well, the Fit for Work test is officially called the Work Capability Assessment. It was introduced in 2008 when Labour was in office, and the coalition government stuck with it because, like Labour, they wanted to curb the growth in the cost of sickness benefits. Now, Atos won the contract to do these tests. It's worth over £110 million a year, and despite the criticism, that contract has been renewed and it'll now run till 2015. Now, last year, Atos say they conducted more than 1 million face-to-face assessments, handling around about 11,000 cases every week.
Carolyn, remind us then what this criticism has been all about.
Well, it's all about getting the test results right or wrong. Many people who've contacted this programme and organisations like Citizens Advice say they've been wrongly assessed as being fit for work when they are not. And the argument goes that many win on appeal, thereby proving that the assessment was flawed. Well, MPs have had a lot of constituents coming to them, and they recently debated the work capability assessment process in the Commons.
I cannot begin to do justice to the feelings of distress, indignation, fear, helplessness and indeed widespread anger at the way they've been treated.
Mr Deputy Speaker, Mrs M was told that she could wear a nappy for work. What sort of country have we become? What sort of ethical values does the government have if that's the degrading and crass way in which decent, law-abiding constituents of mine are being dealt with?
Well, the MPs you heard there were Michael Meacher and Ian Wright, and the British Medical Association and some government select committees and the National Audit Office have all investigated, and some have called for some changes.
But how much is all this to do with Atos, Carolyn, and how much is really to do with the policy, the way the tests were designed in the first place?
Well, Atos do the assessments. They didn't come up with a policy, obviously, but the coalition government itself admitted that the process was not fit for purpose, and one of the first things it did was to appoint an independent review that was headed up by a Professor Malcolm Harrington. He made a series of recommendations, some of which are already implemented. But in the meantime, there is a lot of anger over the process and with the assessors who are employed by Atos, with claims that people have died after being assessed as fit for work. There are even some claims that some people have tried to kill themselves because of the worry of being told they're fit for work if they're not. People will tell you that they don't mind being assessed for what, after all, is taxpayers' money, but they want it to be consistent and want it to be fair.
Carolyn, thank you. Lisa Coleman, who's Atos' General Manager, is in charge of the DWP contract, and she is in our London studio. Lisa Coleman, you've heard all that, obviously. How do you think it's going?
OK, so I have heard all of that, and I think, one of the questions that you asked us a while ago is why now? Why come on the programme at this point? And I think the first thing to say is there's an awful lot of information out there that's misinformation, and that really concerns me, because that means that people are very afraid, very scared, very worried when they come and have an assessment. And I think it's time that we were able to just correct some of those factual inaccuracies. We genuinely are wanting to make sure that when people come for an assessment, they understand the role that Atos play within the process. We don't make decisions, but what we are required to do is treat people with compassion and care and make sure that we provide the right information in order for the DWP to take the correct decisions.
Could I just go back to my question then? Tell me how you think it's going.
OK, so I think that we're meeting the requirements of the contract. I think there's always things that we can do to improve our service. And I also think that we're very open to get feedback from people to help us do that.
Well, I'll come on to that in a minute, how open you are to feedback. We asked our listeners for questions. A lot of the questions that came were about basic competence and being treated with a lack of respect. So we have all the names and email addresses for these listeners, but I won't name any of them. This one is typical. Barnsley scored me 0 points on my medical. It was overturned on appeal. I'd requested an adjustable height chair to sit on and access to parking close to the building. Neither was provided. Whatever Atos may try to say to you, they make the whole performance stressful and undignified in order to try to put people off claiming. Can I ask you what you'd say to that?
So the first thing I'd say is, we don't have any targets about taking people off benefit. We certainly don't, and I know that's one of the things that's regularly said. What we do try to do is ensure that people who come through our process, that we can get the right information from them to make sure that we can give the right information to the department. So, for example, if people have got concerns about coming to a particular centre, what we've done is try to improve all of our information around parking, how to get access. And what I would ask them to say is, if you're contacting our contact centre and when you're making an appointment, please ask. We'll give you details of the right place to park, how accessible our sites are, and we try to make it as easy for people to attend those assessments as possible.
Well, so you're saying now, the whole point is that our listener and many others like her say that isn't the case. I've just had... the woman says she asked for features which were not there. She needed a special height seat. She didn't get one. This email... Why will no one reply to letters or emails? Who are these people accountable for? This one, a family member whose appeal was lodged last May, hasn't yet been dealt with. He has been sent 5 medical forms and is only due to attend his latest medical next week, and yet he has been told his forms have not been received when they had been signed for by the Atos staff.
And that in itself, if there are cases like that you've got, then that's clearly worrying, and I'm more than happy for you to give me that information after the interview, and I'll certainly look into cases.
But that's not a way to handle complaints, is it, for you in an interview live on the radio to offer to take up individual cases? I mean, my point is that, with respect, it's easy for you to come on and say that people should just complain. Our listeners are telling us that when they do, their emails and letters are not answered.
And that, and I would actually refute that. What I've come on today is to try and give people information about the service that we deliver. What I'm really interested in, though, is if you have got that information, then clearly I'd like you to share that with me after the show. What I will say, though, is on our complaints process, we take them very, very seriously. If somebody complains, we don't just go back with stock answers. We look at every single complaint individually. And if there are things about our service that we can improve, then we will take that feedback and we will make those improvements. And we have done that. And if we get it wrong, then we're quite happy to say that we got that wrong as well.
Your critics say your assessors make too many mistakes. Dame Anne Begg, who chairs the Work and Pension Select Committee, she suggested when you were giving evidence to her, and I'm quoting now, "You're a private company, you're driven by the profit motive, and the incentive is to get the assessments done, but not necessarily to get the assessments right. You don't get penalised for making mistakes, do you?"
We do, actually. I mean, we do have targets around quality, and the department have said that we meet those targets, and we're always working with the department to say, how can we improve those targets and what can we do better in terms of quality. We do also have checks and balances within the process that allows us to see, okay, have we, is something not quite right? So, for example, we have targeted audit of all our practitioners.
Do you have targets around how many people take these decisions to appeal and how many people win?
No, absolutely not. And I think what I do need to clarify is, the appeals are not against the Atos assessment. The appeals are against the decision that's been made for entitlement to benefit. What we're really keen to understand...
Your people, so just let's make this clear to the audience who haven't been through it. Your people do the assessment, they write an independent report, it then goes to somebody who works for the job centre, and they make the final decision.
That's absolutely right.
Your fingerprints are absolutely all over it. And if people are going to appeal and people are winning their appeals, that's because the assessments are not being done properly.
No, absolutely not. And actually, if you look at the evidence that came out of the appeals service that was reported at the Public Accounts Committee, and actually the NAO themselves said it was a very dangerous assumption to assume that appeals were overturned because of the Atos report. Actually, the stats that came out at that point was that less than, I think it was about 3 in 1,000 were anything to do with the report. Now, in my opinion, 3 in 1,000 is still too high. And what I would really like to understand more about is actually what happens in the appeals process. We don't actually understand, people have appealed or what the outcome is or why that appeal was overturned. And at Atos, we're very, very interested in that feedback, and we're working very closely with the department to get that feedback, because that will then allow us to say, okay, was it something in the Atos report? Was it something in the service? Was it something at the decision-making process? And that feedback loop is very, very critical to us.
We've had a lot of emails from people who point out that any incompetence is harder to to bear for people with mental illness because they find the test process more stressful because of their condition. We accompanied one woman named Jenny Fletcher to what was her third work capability assessment in Portsmouth 18 months ago. Here she is.
I'm suffering from severe depression. I also have physical problems. I've been through 2 work capability assessments before. I, quote, failed both of them and had to appeal both of them. One appeal succeeded on tribunal. For the other one, I complained directly to Atos. Atos themselves withdrew it and said it was incompetent.
Why did it not happen?
Because the doctor couldn't complete it within the time that we needed to go. So we've got to rebook.
That's because the community psychiatric nurse who's accompanying you obviously can't spend the whole afternoon here.
Yeah. I'm just so wound up now.
Here's another example. My husband suffers from long-term clinical depression. We went through the Atos process 2 years ago. He was pronounced fit for work. We appealed. The decision was reversed. Then this year the assessment process began again. He couldn't face it, and so we agreed he shouldn't have to go through it again. And therefore we now manage without the benefit, which means I have to work long hours, and I feel it's really unfair. Lisa Coleman.
Well, clearly, when I hear those 2 accounts, then that my first feelings are of one of that's not right, and I'm very, very sorry, particularly about the Jenny Fletcher case. We certainly did actually quite openly and transparently review that case, and we did say that we felt that there were some weaknesses in the quality of the report. However, we also said that we were finding it quite difficult to complete the assessment. Now, if we do get something wrong, and this is a service delivered by people to people, and therefore that means that we're human beings, and sometimes we do get something wrong, or it doesn't go quite as well as we'd like. Now, what we will do is we'll hold our hands up, we'll apologise, and we'll look to see what we can learn from that.
Do you accept that although this process is being constantly reviewed, constantly modified, for the people who have come through it since 2008, there's been a lot of individual human suffering? Do you think that's inevitable?
I do accept that there's been an awful lot of change around this whole benefit. I mean, I'm not sure whether many people are aware, but Atos have actually been delivering assessments since 1998. So we started back in incapacity benefit days. So we've been doing this for over a decade now, and in that decade we've seen an awful lot of changes around the welfare reform agenda. And since 2008, there have been a lot more difficult changes and complex changes. And I think that complexity certainly means that there's a lot more stress and a lot more anxiety for people. And that stress and anxiety and people coming into our service, that clearly worries me. And yes, I do think it's a lot more anxious time for people.
Do you want to say sorry to anyone?
If we get something wrong, then I'm very happy to say sorry. And as I've said earlier on, we do that.
Lisa Coleman, Atos' General Manager in charge of the Department for Work and Pensions contract. Thank you very much for coming on. On the 30th of April, the Department for Work and Pensions is going to publish some new statistics about the number of people appealing those fit-for-work decisions. The department says it's just over halfway through reassessing the 1.5 million people on incapacity benefit to see if they will get the employment support allowance. So that's what they had to say about all that.